Week 6 Advanced Concepts presentation. My name is Robert Macaulay. Here we go. Full overview of what we're going to talk about. How does aspirin work, pathway and the mechanism. Walk you through the pathway, the structures, metabolite names, enzymes, cofactors that aspirin inhibits. Show the mechanism, how it covalently inhibits. Part 2 is going to explain prostaglandins, what they do in respect to inflammation, and how inhibiting their formation will reduce inflammation. So let's get in here to part 1. Aspirin, also known as acetylsalicylic acid, was actually discovered from people chewing on willow leaves, which contain salicin, which is turned into salicylic acid in the body. Aspirin will be dissolved in the stomach. The small particles go into the small intestine, the blood, where it's carried out for its purpose where it is needed, depending on where there's an injury, infection, or anything like that. Prostaglandins, they are fat-derived molecules that are responsible for fever, pain, and inflammation, as well as a couple other things that we'll get into a little bit here. Aspirin blocks the production of prostaglandins, which leads to many different processes, which we'll discuss. Here we have a couple of diagrams. You see the fatty acid, which would be the prostaglandins. It's catalyzed, or its process carries out through cyclooxygenase, which is going to give you your intermediate prostaglandin and prostaglandin H2, and then there's 3 other factors that it could then boil down into, which have a variety of different things that they can do. So basically, no matter what, the fatty acids are going to be produced, and then we'll get into the aspirin part a little bit. We'll talk more about what do prostaglandins do. So the functions, they can act on the hypothalamus, which is going to increase body temperature. So that would be like your body's natural reaction to fight off infection, increasing the temperature to make it a worse environment for the bacteria or infection to thrive, so it would kill it off. This will also can damage your own healthy cells as well a little bit too, which is why you can feel pain and aches and stuff while you're fighting an infection and while you have a fever. Prostaglandins also stimulate immune cells and cause inflammation, so that will release those cells that can fight off. It'll sensitize nerves to pain because the prostaglandins will go through cyclooxygenase and then come back and then hit your nerves and send pain receptors to the brain. Prostaglandins can also initiate blood clotting, which can be good or which can be bad. If you cut your finger, it's good for that, but if people with like heart disease who are at increased risk of blood clots, that's why people will take daily aspirins. It can constrict or dilate the blood vessels depending on the concentration of prostaglandins, produce mucus in the stomach to help protect the stomach lining from acid. And we'll get a little bit more into that here in a bit too. But essentially, aspirin is going to stop it right here. It's going to inhibit the cyclooxygenase from breaking down the prostaglandins. It's going to, I have a picture coming up in a little bit, but it's basically going to inhibit the prostaglandins from transferring into pain receptors and block that from happening. We'll get into the next slide here. So aspirin blocks cyclooxygenase from working or from changing into the pain receptor and attaching to the nerve and sending that to the brain. So prostaglandin synthesis, which this is going to prevent pain, fever, and inflammation that the prostaglandins would normally cause. While it stops the negative aspects of prostaglandins, it can also stop things that you would want to occur, such as the mucus in the stomach decreasing and allowing stomach acid to burn through the stomach. So if there's somebody that is more susceptible to stomach problems and they were to take a daily aspirin, it would decrease the amount of mucus in their stomach, and it's also going to make their blood clot less, which could cause an ulcer in their stomach, which could cause them to bleed, which would be bad. Positive aspect would be for patients with heart disease or more likely to clot. If you don't want them to clot as much, you would want them to take a daily aspirin. So that's the point where you'll see a lot of cardiac patients taking a daily aspirin to prevent this, but normal people wouldn't need to do this necessarily. So those are some of the effects that aspirin would have on the body. And then here, a little visual aid. Basically, if you look at that tealish molecule there in the middle, that's going to be your acetylsilic acid. And the purple area there, that's going to be your cyclooxygenase here. So cyclooxygenase, basically the aspirin in your body, acetylsilic acid, is going to take that, and these little reddish pinkish things are going to be your prostaglandins. So it prevents the prostaglandins from getting through and then coming back through as pain receptors. So it will prevent them from entering the cyclooxygenase. It functions as a catalyst so that the fatty acids cannot enter and be transformed into pain receptors, as I mentioned. So less pain receptors are getting to the nerve and less pain response is being sent to the brain. And then this is like little part 2, prostaglandins and inflammation. Kind of talked about it a little bit, but we'll hit on it a little bit more. Prostaglandins act as vasodilators and are one of the more potent mediators causing increased blood flow in your body. Basically what that means is that it's going to make the blood flow easier and faster. So these white blood cells are going to be able to flow faster to an area, and the white blood cells are going to be the things that release and cause inflammation in the area. So by inhibiting prostaglandins from carrying out their processes, you're preventing more white blood cells from getting to the area, which is going to prevent inflammation from occurring. I hope that kind of makes sense. If you have any questions at all, just let me know.